you so much, everyone, for making it so early this morning at the end of the 2 weeks at COP and talking about this really important and under-addressed issue. So, today we're here to talk about the impacts of climate change on women's health and rights, particularly sexual and reproductive health and rights, which is an issue particularly in the MENA region that is under researched, under addressed, and not mainstream enough in national climate policy and international climate policy. And as we've seen through different studies by different NGOs, that still until this day, while health has become a mainstream or becoming an increasingly mainstream topic and an addressed topic when it comes to climate action, specifically related to health related impacts of climate change, we still find that SRHR is lacking. And this is both in health NAPs and in NDCs. So I'm really pleased to have these wonderful panelists with us. And let me just quickly introduce. So here we have Safa Adjousi from Oxfam. Can we just have this slide? Um, okay. Yeah, Safa Adjousi from Oxfam, the Regional Climate Justice Advisor, specifically for the MENA region platform. And we have with us also Tara Daniel, who's a Senior Manager for Policy at WEDO, Women's Environment and Development Organization. And we also have with us the partner for the study, Ferdinand Girk, the Regional Advisor on Climate Change for Bread for the World MENA region. So thank you so much. So we're gonna first start the event with having a opening word by Mona Al-Hamadi, who is from NOBD, from NIDIO, NOBD, the Development and Environmental Organization. Yeah. Um, and yeah, let's just start with to hear from Mona, who led this study with Bread for World MENA, and which is the first ever study on SRHR impacts in Yemen, specifically related to climate change. So if we can have, thank you. Sorry, I think there's a few technical difficulties. Yeah, and while we get the sound, let me just say, so Mona Hamedi led this study with Bread for World MENA, and she couldn't be with us today, unfortunately, but we're still happy to be here to launch her study, which is very
This
important.
is Minal Hamadi.
And
I'm
yeah,
from
here's the
Yemen.
video.
I am the head of partnership at NABD organization, a youth-led organization working in Yemen on climate action and gender equality. We organized this side event with Bread for the World, but unfortunately I couldn't be with you today at COP29. I hope you enjoyed the session with our great speakers. Also, we wanted to take this chance to present our study on the impact of climate change on sexual and reproductive health, which is funded by Bread for the World. Our colleague from Bread for the World will present the study, and I hope you enjoy it. Please do not hesitate to contact me if you have any questions or recommendations or comments regarding the study with my email and phone number, which you will find in the last slide of the presentation, or you can talk directly to Mr. Ferdinand. I hope you enjoy your time at COP29. I hope you enjoy your side event, and I hope you enjoy reading the study. Bye-bye.
Bye bye, Mona. But no, it's great to have this video and to set the scene. I think it's great to launch and start off with the study to understand what are the impacts on the ground and to hear more from this study that has been done in a particular region in Yemen and understand from women and from this research what what is happening to sexual and reproductive health and rights, and how is it impacted by climate change. And then later on, we'll get into deeper, more climate policy related. So thank you, Ferdinand, for being here. And I wanted to ask you, so how does climate change uniquely threaten the reproductive rights and the sexual reproductive health and rights of women and girls, especially in marginalized communities?
Thank you so much, dear Nada. Also, thank you so much to UNOCHA and the Humanitarian Hub for hosting us here today. Regarding your question, I would first like to present our research, and then maybe at the end I can be more specific. As already introduced, we are very happy to launch here the preliminary results of a study that was conducted by Muna and her team in Yemen, called Climate Impacts on Sexual and Reproductive Health Rights of Women. This is a first of its kind study in the MENA region. This topic, as already introduced, especially in this region, has been understudied so far. So we are very happy to be able to contribute to this research, which is much needed in order to support women and girls better. A short start about the genesis of this study. How did it come across? So on the top right, you see the Evangelical Agency for Diakonia and Development, which is a Germany-based organization that has two brands, Brot für die Welt and Diakonie Katastrophenhilfe. Brot für die Welt having more long-term development aims, and Diakonie Katastrophenhilfe being more in the humanitarian sector. Both of these brands have decided to support their partners through capacity building and networking support in terms of climate justice through the West Asia North Africa Dialogue Office for Climate Justice. This is what I am working for with a colleague, and we are close network partners of the Women and Gender constituency in the region. So we are working closely with that constituency, including my colleague Nada here and also Muna. So we have talked with them and we're trying to support their work, and they came up with the need for this study, which was then implemented by NDO in Yemen. So this is kind of the construct behind the study. So without further ado, let's jump right in. The content of this short presentation, first a short introduction, then what is the study problem, the objective of the study, some of the results and the recommendations. So here we go. The study was conducted in Yemen's Taiz Governorate, specifically in the districts of Al-Mizrah and Mashra' wal Hadnan, which are both very hard hit by climate impacts, which of these they specifically, I will come later to that. The aim of the study is to explore the effects that climate change has on the sexual and reproductive health rights of women and girls, specifically also focusing on the social and economic factors associated with these impacts. The study used a mix of different methods, qualitative and quantitative, so interviews and surveys, but also desk review of existing policies, of course. The study sample were 50 women and girls from the communities, from the field, so to say, and then 30 health workers and 5 reproductive health officials. So here are some pictures from the study. The interviews being done also in the offices, in the local health clinics, and in the field. So the study problem that NDO tried to tackle is that women and girls face more and more diverse health challenges that have increased over the past years. So that in specific are increased infectious diseases, water and airborne, higher rates of miscarriages, higher rates of premature births. And the question now is, like, how could these health challenges be linked to the climate changes as well as the environmental pollution that is affecting these governorates? And of course, which adaptation options are available, which are already being taken, and which maybe should be taken in the form of recommendations. So the objectives of the study, again, is an evidence-based identification of negative climate impacts on the sexual and reproductive health rights of women and girls in Thais Governorate. The focus here is on evidence-based because there's a lot of there's a big lack of evidence and studies in this field, even though the causal links appear clear to many of us, and more evidence is needed. So a strong focus on socioeconomic factors that act as intermediary variables, and also specific recommendations are included here. And then also, like, how could these recommendations be better included into policies and projects? So let's come to the results. 98% of families interviewed and people interviewed reported experiencing climate changes. The main disasters that are linked to these climate changes are floods, droughts, and heat waves. So extreme heat waves. And the climate impacts on family life, you can see here on the right. So the main impact has been illness, followed by destruction of agricultural lands, water source damage, and public service damage. So in short, it impacts health negatively, agriculture and food, access to public services, water availability, housing, and also leads to increased discrimination against women. We'll come to that later. So the climate impacts on the sexual and reproductive health rights, you can see here, especially on the health, less on the rights, is the increase in miscarriages was reported by more than 2/3 of the respondents. Increase in premature births as well. A weakened immunity due to malnutrition was also reported by nearly half of the respondents. So in the interviews, we were able to establish the following impact chain between these phenomena. So the climate changes like heat waves, droughts, heavy rains, and floods lead to the destruction of water and food resources, water and air pollution, which then negatively impacts the health, especially of women and girls, in terms of increasing miscarriages, premature births, and weak mother and child immunity. And it also negatively impacts their adaptive capacity in terms of the resources that they have available. So the main challenges faced by women and girls is in accessing resources, because traditionally they are the ones responsible for getting water, for example, to their households. So here you can see the impact on accessing water resources. The main thing that, for example, through droughts or less or more extreme rainfall, water resources have dried up, so you have to walk longer to reach. So the distance is the main reason mentioned. Then the cost, of course, if there's less water around, the cost increases. Then conflict and violence and discrimination also feature there, especially, of course, since they are also linked to distance. So all of these factors are exacerbated by climate changes a lot. Here you can see one of these wells, just to get an impression. So these were the results so far. We are yet to launch the full study, but you can find here on these chairs the executive summary, also with the QR code to the link to the contact of Muna. Here are the recommendations that NDO came up with. Raising community awareness of both men and women about the climate change more generally, and on how, through decreasing resource access, it negatively impacts the sexual and reproductive health of women and girls. Supporting healthcare facilities with medical equipment, and expanding the basic reproductive health services, particularly in remote areas. Installing rainwater harvesting tanks to facilitate access to water and develop resource-saving irrigation techniques to support agriculture amid more droughts. Implementing locally led agricultural adaptation projects with a special focus on improving livelihoods of women and girls working in agriculture. Always linking climate adaptation projects to livelihoods, as this will reduce the reliance of women on physically demanding work that affects their health. Offering psychosocial support for women and girls affected by climate impacts. Strengthening the integration of public climate and health policies and efforts in affected areas. Integrating the perspectives and rights of women, particularly their sexual and reproductive health rights, into the development of any climate-related national policy and or strategy. So, as a conclusion, I'll wrap up soon. Nada. I'm sorry for maybe taking a bit of time. Through decreasing the access to resources such as water, which is linked to women's and girls' roles in Yemeni society, climate change is affecting their health disproportionately. So this first of its kind study in the West Asia, North Africa region outlines measures of how to tackle this crisis. So in short, climate justice is gender justice, and urgent action is needed to protect women and children now. Maybe just in the end, to come back to your question, I think what these results yield again and again is that, climate change, especially in these fragile contexts like Yemen, is really just exacerbating the basic inequalities and needs. And we need to work on basic services. So climate action is not always, rocket science, but it's like really looking closely on who's most affected already and how this will develop. So thank you so much, and also a big thank you from Muna to all of you. So looking forward to our discussion.
Thank you so much. And what a great study that really perfectly highlights all the various impacts, both health but also social and economic, which are, of course, determinants and shape the disparities and the health disparities and the gender disparities, and really emphasizes that climate change is a gendered issue, and depending on your identity and where you live and what your background is really shapes these impacts, and that certain structural aspects to it create barriers, and that these barriers are what makes women and girls more vulnerable, puts them in vulnerable situations. And we also see that the gendered responsibilities and the gendered norms and social norms play a big role also in placing more burden and responsibilities on women and girls. And what we see here is that, first of all, we need more research like this. Evidence is what informs policy, and with a lack of evidence, it becomes very difficult to create targeted policies that address the root causes and really address what is needed on the ground. As again, I mentioned that this is still something that's very much lacking, and as an inherently intersectional issue, sexual and reproductive health and rights play a big role in all aspects to women and girls and their lives, and how they can build, unfortunately, like having that responsibility to build capacity and resilience to adapt to climate change. And again, this is connected to, like you mentioned, climate change threatens to exacerbate already existing inequalities. And within climate change, there's so many different aspects to it, not just adaptation, but also just transition. As we move towards a more regenerative economy, one that's not based on exploitation, on rampant greenhouse gas emissions, how can we make sure that women and girls are not left behind? So, Safa, as a expert,
أنا
oh, yes. Sorry, my bad. We're going to have a video first, and then we'll go to Safa. Video on related to the impacts of climate change on women and girls, which again will bring home this issue. Thank you. You can go ahead.
أنا عربية، سيدة من ريف عربي. أنا وتقريبا 30% من نساء الدول العربية نساء معيلات، مسؤولين بشكل مباشر وكامل عن أسرنا. السنة اللي فاتت خسرت شغلي عشان المزرعة اتسحرت، ولما حاولت أفهم عرفت إن التغير المناخي هو السبب. عشان كده حبيت أكلمكم إزاي التغير المناخي بيأثر علينا كستات وإزاي نقدر نواجهه. التغير المناخي بيأثر بشكل مباشر على قطاعات مهمة زي الزراعة ومصايد الأسماك، والإحصائيات الدولية بتقول إن نص العاملين في المجالات دي من النساء. وآخر قياس لأثر الكوارث المناخية قال إن احتمال وفاة النساء والأطفال أكتر 14 مرة من الرجالة بسببها. وللأسف أسباب كتيرة بتفاقم آثار الكوارث المناخية علينا كنساء، بالأخص في الدول النامية، زي استخدام الدول الكبرى اقتصادياً الوقود الأحفوري في الصناعة، وضرب عرض الحائط باتفاقية باريس واللي نصت صراحة ولأول مرة على تقليل الوقود الأحفوري. إهمال دول المنطقة العربية لمشكلة التغير المناخي، عشان كده مفيش خطط للتعامل معاها أو مع نتائجها السلبية، ومفيش تمويل كافي لتمكين النساء من مواجهة نتائج الكوارث المناخية. عشان كل ده أنا وكل النساء الشبكة العربية للمجتمع المدني النسوي بنطالب بدعم النساء في مواجهة التغير المناخي من خلال وضع سياسات وآليات لتأمين النساء وتعويضهن من آثار التغيرات المناخية، لأن هم الأكثر تأثراً بيها وبنتائجها. التوسع في تطبيق آليات التكيف لضمان حمايتنا كنساء وعدم تعرضنا لمخاطر هذه الكوارث. توفير المعلومات المناخية والاستعداد لمواجهة الكوارث قبل حدوثها. ضرورة مشاركة النساء في مراكز صنع القرار الخاصة بسياسات مواجهة التغير المناخي، ومراعاة احتياجاتنا كأولوية عند تصميم الحلول على مستوى محلي ووطني وإقليمي وعالمي. توجيه تمويل كافي خاص للمنظمات النسوية في ملف التغير المناخي لتمكين النساء من مواجهة الآثار الناتجة عنها. أنا عربية، سيدة من ريف عربي. أنا وتقريباً
Thank you so much. What a wonderful video that also again brings back that this is not an issue just in Yemen, that it's an issue across the Middle East and North Africa, and not, of course, just in the Middle East and North Africa, but in all the global South countries. And it emphasizes this issue of justice and that, you know, without effective mitigation, without maintaining that 1.5 degree goal, and especially here being in the context of COP29, where we have the NCQG being negotiated and the Gender Action Plan, which I know our speakers will touch upon. Without developed countries, without the global north taking responsibility and making sure that they pay up according to their responsibilities as the drivers of climate change, particularly to those who are made vulnerable because of systems and structural systems of inequality, but bear the biggest brunt of trying to build adaptive capacity and resilience, and without resources, and not just without resources, but in an environment that is constantly trying to disempower and disenable them. And we'll touch on that more later, but it was such a great video to also show that it is a very gendered issue and that climate change impacts women and girls differently. And that includes, of course, how can we make sure as any change happens in the world that they're not left behind. So Safa, as somebody here works extensively on this, could you tell us more how a just transition can improve the health of women and girls?
Thank you so much for this opportunity, and thanks for Mona. And I like that we showed the video for the Arab Feminist NGOs network, because they are a strategic partner for us as Oxfam. And as a person, I'm really proud that we are supporting a, this network, in which we started the work with them in just before the COP in Sharm el Sheikh. And before that, as Oxfam, we wanted to answer the question why feminist organizations are not that engaged in the climate change sphere. So we did a research, both the quantitative and the qualitative, to discuss and to answer the question. And what came up, we know, but we should have research to have an evidence-based recommendations. But one of the main reasons was is the conflicted priorities for the feminist movement in the region, lack of funding and lack of information that they have on the climate justice issue, just energy transition, just the transformative solutions. So what we did is that we started working with the Arab Feminist Group by convening them into a meeting in which they discussed climate change. And from then until today, we have been working a lot on not only capacity building, but also trying to connect the feminist movement from the region to the climate change movement. And the climate change movement in the region are not really inclusive. And this is another issue that we have, because it's a reflective of the shrinking civic space in the region, but also but also how civil society works in general. So this is where I wanted to start, because of the work with the Arab Feminist Group in Oxfam in the region, we have prioritized the feminist climate agenda. And it's a priority for us as an organization globally, but in the region, in which last year we also looked from a regional perspective. Before Munadu doing this, she was interviewed for our research as well, is the impact of SRHR on the intersectionality between SRHR and the climate justice in MENA region. And it's not really different from what is discussed on the national level in Yemen, because we have different context but same climate impact, more or less, same cultural norms, and same society structure in the region. But adding to that, we have the conflict angle. And this is where we wanted to work more on the just energy transition and just a transformative solution, to have a feminist perspective to our program interventions and advocacy interventions within the region as Oxfam. So beginning of this year, until today, we have been documenting stories and programs implementation on just energy transition and just transformative solution, and how our our lens should be more feminist from partners and from within Oxfam, because if we want really to change, we need to change from within. And a few of the insights that I wanted to share, and I'll wrap up quickly, is that we always tend, when we talk about the just transformative solution and just energy transition, tend to focus only on emissions reduction, like to limit the global temperature by 1.5, or to install the renewable energy in communities. No one really talks about how it's and also in the conflict setting a lot, because Oxfam is also development versus a humanitarian organization, so we have access to communities that other organizations don't have. We see that the WASH intervention in some humanitarian organization are not gender transformative and not feminist transformative. So even in the once we start discussing the program intervention, the design of the program, we need to think about the feminist perspective. And it's all well connected and interrelated, because when we talk about the causes of everything happening in this world, they are patriarchy, capitalism, and neocolonialism and colonialism, and the extraction of resources in the global south. And this is what is causing most of the conflicts. Also, we have also at Palestine and the occupied Palestinian territories the issue of the occupation, in which a lot of women don't have access to basic resources because of this issue. And when we interviewed them, and we with Oxfam and our office there were multiple stories on how women got benefited from renewable energy access from different programs from partners and Oxfam, to bring basic things like laptops to go, because they needed to charge their laptops to go to university. Um, they Some communities, they didn't have access to water, so we installed like water pumping devices that is running on renewable energy. But also in some cases, in our partners in Lebanon, for example, because of the current escalations, and in Lebanon, they don't have access. And before that, because of the situation in Lebanon, they don't have access to electricity. So a lot of a charity organization, and we worked and documented a charity organization working with people with disability, in which they installed renewable energy, but also made sure that they have access to basic resources. So it's all well connected and interlinked. I cannot speak about the jet away from SRHR and access to water, away from access to energy, because a lot of schools, for example, a lot of girls, they don't go to school in certain days of the month because there is no water access in the school. So how we can solve that collectively, because it's not only about the feminist perspective, but also access to basic resources. So this is in general what I wanted to highlight.
Oh, thank you so much, and emphasizing really that it is, and I think this is what scares people, is that it is such an interconnected and intersectional and multidimensional issue, and particularly when we add aggravating factors like fragile contexts, like conflict, occupation, which is the reality of our lives and the reality of the world, and how that impacts the accessibility, the availability, and also just the ability of women and girls to live a life that enables them to be healthy, to pursue opportunities, to live a life like anyone else. And all these, and it's very important to have that holistic and comprehensive perspective. And this is also what I believe is so important in what we've seen in the video and in the research, is that a big part of it is also just speaking to those on the ground, understanding, putting them on the decision making table, listening, hearing what are their needs, what are the barriers they're facing, because there's no inherent vulnerability. It is systems and structures that create it. And thank you so much for elaborating that. And I'm going to have one quick question for you, and then I'll move to Tara. How can or how should the NDCs take into account the health of women and girls?
A lot of there are different angles to that. So we know that the NDC's review will hopefully will end in February because of the global stock take. This is on the international level. But when you look at the MENA region and the NDCs in the MENA region, and I think we did an amazing also analysis on the NDCs, is the lack of gender perspective. As Oxfam, we have looked at few countries around the world, including Palestine, but also we are now looking at Tunisia, Egypt, Jordan, and Lebanon on how inclusive were the previous processes for NDCs. And and in our research that is called the People's NDCs, we realized that feminist voices were not included in the NDCs because they were not as the research that I mentioned at the very beginning of my intervention, that a feminist organization in our region, they are battling a lot of things, and it's including the shrinking civic space, and there is no access to finance their participation, for example, in the COP. how many people are struggling to participate from feminist organization in the COP. And those spaces where they can influence the NDCs. Uh, Working with the government closely from the beginning is something that is really important. That's why networks like the Arab Feminist Network have been working and trying to work with the government on enhancing their NDCs and having a gender component. And I think health component is very important in the NDCs. In some country, it's stronger than others. But if we have health and gender, then we can have a hook for SRHR, because I'm not aware of any NDCs that has SRHR in the first place in the region, and we barely have gender component. So the influence that we can have is, once we have those hooks in the current NDCs, we can also work in the next 5-year cycle or 10-year cycle, whatever it will be. It will be actually agreed on the next year. But yeah, the NDCs review, the NDCs cycle, and it's very bottom up. So working with communities, making sure that the communities that I mentioned that we work with as Oxfam and our partner be involved in decisions, because most of the NDCs, the way it worked in the region, it just ticking the box that we talk to civil society, but it was not active participation of civil society, and this needs to change, and in some countries it does.
Thank you so much. And thank you so much also for bringing up the issue of participation and meaningful participation, especially when we're talking about trying to prevent, alleviate, address disparities and inequalities, and those that are further marginalized, both socially and spatially, are often further excluded. And that means that even when, for example, and NDCs integrate SRHR or gender components, then we can find that they're centralized in hubs and urban centers. But then those that are already lacking access to basic, services and health services, then they're even further marginalized, which leads to a lot of compounding issues. That is just not that is not only health but also social, economic. So thank you so much. And thank you so much for giving analysis and context in the MENA region. And I also encourage the audience to look into, because there are a lot of resources and studies that have analyzed NDCs, that have analyzed national adaptation plans and health national adaptation plans, including Oxfam and including the Sexual and Reproductive Health and Rights and Climate Justice Coalition has lots of resources that you can look into and understand the current context and the current gaps and where we need to fill and then address them. And this is also particularly important when we have the new IPCC report coming out, and how can we make sure this is well founded in the research that is already available, and especially research from the Global South and from the MENA region. Thank you so much, Safa. And Tara, I know that you do a lot of work on not just sexual and reproductive health and rights, but its intersections with gender and climate finance. And I wanted to hear from you, how should sexual and reproductive health and rights be integrated in international and national climate policy?
Thank you so much, Nada. And in addition to speaking in my capacity as a staff member of the Women's Environment and Development Organization, I wanted to also highlight what you just mentioned, the SRHR and Climate Justice Coalition, where I have the privilege to work with you and Muna, and to really look at the spaces where we can bring together this key advocacy on SRHR and climate justice. So one of the things that you just mentioned, if we're thinking about national policy, are national adaptation plans. And the work that the National Adaptation Plan Global Network has done a few years ago, looking at SRHR within the available plans at the time, showed that maybe half of them had a few elements. But we know comprehensive SRHR is something that is overlooked when you're thinking about it as a whole suite of services. And we saw the variety of impacts that have been quantified and qualified by the communities experiencing them. when we think about the finance component of this, the Standing Committee on Finance's second needs determination report looked at the available national adaptation plans and said that there was a costing need of over $840 million, or it might be billion. Sorry for not having that exactly in my head right now. And that was across only 37% of the needs that had been identified. Of course, these vary and lengthen beyond SRHR, but we know that we cannot be investing in SRHR. We cannot be fulfilling these national adaptation plans that do have any of these components if the funding isn't there. So in addition to really integrating SRHR into the NAPs and into the NDCs, which is also critical, we want to think about the Gender Action Plan and the Lima Work Program on gender, and recognize that even though in the negotiation rooms there's a lot of pushback against, unfortunately, the recognition of intersectionality, that the very fact of saying that activities should be implemented in a gender responsive manner means that we have to consider SRHR because the interlinkages are so clear. And so it's always been the position of the SRHR and Climate Justice Coalition that you cannot have full implementation of the activities, even in this current gap for the past 5 years, and whatever new formulations we see of the Enhanced Lima Work Program on gender and new gaps without this deep consideration. So when we want to zoom out and think about some of the finance conversations that are happening here politically as well, we do have to think about the investments in SRHR and resilience that cannot be made because of our current global financial architecture, and including climate finance. So as everyone here is looking at the new collective quantified goal and saying that, of course, if you are considering the needs and priorities of developing countries, you cannot have debt-inducing elements of climate finance. We want to think about that within the scope of how much debt service is eclipsing the investments in health and education around the world. The United Nations Conference on Trade and Development estimated that there were 3.3 billion people living in countries where their debt service is more than their health or their education spending. So we cannot move forward on the SRHR policies we need that intersect with climate change, such as having a minimum initial service package for sexual and reproductive health and rights implemented in every country, recognizing the humanitarian context has done the work to outline what needs to happen, but it must ultimately be funded. And for us to be thinking about these intersections in new ways and thinking about the ways that health workers are on the front lines of the climate crisis, thinking about the ways that we need to be integrating and fully funding doulas, for example, and recognizing that their accompaniment of pregnant people now includes an assessment of the risks of climate impact that those people are facing. So we need to make sure that we're staying connected in these conversations. As Sofa was saying, everything is interlinked, everything is interconnected. And then using these specific examples that we are getting in research like this to really make this case of how this is not only about the specific activities that need to be happening locally, but the entire national and global political and policy architecture that's going to support fully recognizing that SRHR cannot be achieved in a world of climate chaos, in a world, as I think, Nada, your framing was perfect, that exceeds our 1.5 degree temperature limit. And so I hope that we're able to have these conversations in ways that connect the local to the global here. And thank you so much.
Thank you so much, and thank you so much for bringing all these together. And again, you know, it's as you have all so clearly highlighted that they're all interlinked, and it's all an interconnected system, and not just the impacts, but also the systems that have cultivated and perpetuate inequalities economically, socially, and as well have driven the climate crisis, and how debt and and the international finance architecture plays a significant role. And that is why when we speak of finance, we speak of it as a matter of justice and equity, not because simply the fact that not only was the climate crisis driven by the global north, but also it was driven on the backs of the global south and on the exploitation of the global south and the continuous extractivism of the global south. And unless we address that, unless we, as you perfectly articulated, unless we address these systems that continue to do so, unless we change it, unless there is also the finance component that can help create those enabling conditions, we're not going to change it. And we're also not only going to address and mitigate the climate crisis, we're also not going to reduce inequality, and we're not going to help support women and girls to achieve and fully realize their sexual and reproductive health and rights. And we're not going to achieve the goal of gender equality and general equality, because inequality and the SRHR issue and climate justice and just transition is an intersectional issue. And every component of where you are, where you're living, where you're from, your race, your ethnicity, your migration status, all of this plays a significant role in how you are impacted and how you are in a system that gives you the opportunities and the resources to build capacity. And particularly the issue of debt, if we look at the Middle East and North Africa, is a very significant issue. And I love the example of, when we're not spending money on investing in our health and well-being of communities and individuals, if we're not spending money on, unfortunately, building this resilience and adaptive capacity, then we're spending it on things like debt, like militarization. And there's this, as the new quantified collective goal is being negotiated, there's this saying that there's not enough money, but there is. Last year in 2023 alone, $2.4 trillion were spent on militarization and war. So if we're asking them, and according to what you mentioned, the needs developing report, am I saying it correctly?
The needs determination report.
Needs determination report. It costed needs that were from between 1 trillion to, I think, 2 trillion or 1.5 trillion. Correct me, please, if I'm wrong, Tara. You're the finance expert.
Yeah, so looking at the trillions of dollars for implementing all NDCs and all of the costed needs within the NAPs, recognizing that between now and 2030 for the NDCs, that number was before between 5.8 and 5.9 trillion dollars.
Yeah.
As a huge underestimate given the available data.
Yeah.
We'll also say the SCF's report on. And of course, we keep referring to the SCF because we're here at the UNFCCC and want to recognize the work that is being produced by the constituted bodies here. But the SCF report on the biennial assessment of financial flows identified $1.1 trillion still flowing to fossil fuel subsidies annually on average in some recent years.
Yeah.
And some of those estimates in other sources range up to $7 trillion. So these investments that are actually driving the climate crisis, that are driving these impacts, are very much, as you're saying, undermining the goals.
Yes, and they're driving finance away from, climate action, from investing in universal health coverage and in our health systems and the health and well-being of individuals and communities. And, again, the call from the global south is, in relative terms, a small call, like $5 million as a down payment for debt, for the reparations, for the climate crisis and damage.
$5 trillion.
Oh, did I not say 5 trillion? I'm so sorry. 5 trillion, not 5 million, not 5 billion. That's like nothing. And then at least 1 trillion per year And this is according to, not fully costed need and not fully comprehensive assessments. And I know that these interlinkages and the interconnected system seems difficult to address, but what it really is saying is that we need synergies. We need to work collectively. We need collaborations. We need to address it as a whole of society, and that portion is completely crucial. But again, as the video has highlighted, and so many of our speakers have highlighted, this can't be done without creating fundamentally a change in the system that is perpetuating this and driving this, and also putting particularly women and girls at the forefront of crisis. And as they bear this large responsibility, they're also the ones who are most familiar, most able to understand and give us the solutions, and the solutions are there. We have solutions, and the solutions are documented. So it's not an issue of what can we do or how can we do it, but an issue of political will. And this is why I think it's so important, as well as advocates, to work together to transform that political will and make sure that justice, that women and girls and all their diversity, that intersectionality, because climate change, SRHR is inherently intersectional. Our life is inherently intersectional. People are diverse, and if we're gonna focus on the climate crisis, we're trying to address it not for some sort of abstract concept, but for the actual local individuals, indigenous people that are on the ground. And this includes, of course, and I'm not going to be able to include all of those that have been marginalized, but some that have been mentioned, like people with disabilities, people experiencing homelessness, people who are under refugee status, migration status, displaced persons. And again, we have to think about it in each particular context, which in the MENA region, of course, has to do with conflict, with fragile contexts. Thank you so much, everyone, for your time and for this wonderful discussion. And I encourage the audience to look at all the resources that have been mentioned here, and to understand more, and also take this back home to your country, because, on the one hand, there's the international policy, which is key for addressing the justice aspect part and for mitigating emissions, as the global north are the drivers, but also take it home and think about what we need to do on the ground to deal with this unfortunate burden of having to build adaptive capacity and resilience, and making sure that women and girls in all their diversity and marginalized communities are centered and included from the decision making, the design, the implementation, the monitoring and evaluation. Thank you all so much for your time, and thank you so much, Ocha, for having us here today, and thank you so much to all the audience.